Thanks a lot. What can we learn from what happened in 2005 when the Shally ruling came out? And for those of you, well, probably most of you know this, but Shally was actually the first movie in that series. Cambie is the sequel, and usually they're not as good. But so I think there's actually quite a bit to learn from Shally. A few words about what Shally was, for those of you who were on another planet at that time. It's a long story that began in Quebec in 97. Two odd partners came together. One is George Deliotis, an elderly man who had multiple health issues and who pleaded, a bit like in Cambie, that the prohibition of duplicative private insurance infringed on his rights. The other was Jacques Shally, a truly oddball doctor. Really, if you want to just scratch your head for a while, Google what Jacques Chauly did in his life. It's kind of interesting. But in 97, those two people joined forces and went to court to say that Quebec prohibition of private insurance to cover stuff that is in the public basket infringed on their right, and they lost. And they appealed. They went to Quebec appeal court in 2002. They lost again. And then went to the Supreme Court of Canada in 2004. They were granted the right to appeal. And at that point, the basic sentiment is, within those circles, like people like us, was, don't worry, we got this. Evidence is on our side. We are the very serious people, and those weirdos lost twice, so no worries. And that's not what happened. In a very divided ruling, the Supreme Court was totally 3 against 3 for what refers to the Canadian Charter of Rights, but in regard to the Quebec Charter of Rights, Juge Deschamps split the vote 4 against 3 and ruled that indeed it was illegal to prohibit the sale of private insurance for publicly covered medical care in Quebec, and Quebec only. And everyone, I think, at least everyone I know, was like, oh, whoops, like, what happened? And it really was like thunderstruck. And this is when really things got interesting. So yeah, all of you, rest of Canada, that's how we call you, were like, phew, it was close, but we're safe. It's a Quebec-only thing, and still some perplexity, like we were supposed to win this. It was not supposed to go this way. But, whatever. So, but in Quebec, big thing, like the government of Quebec, I think, did not anticipate this. They did not think they were going to lose. And suddenly, some key portion of the Quebec laws regarding healthcare were illegal. So Quebec government asked for 18 months of delay before the application of the law, just to figure it out. They got a year, and that year was extremely interesting. So for 1 year, everything was on the table. Everyone and his brother was giving opinion on what the ruling meant, what should be done, and where should that thing lead. So on the one side, you had all the super right-wing think tank that were arguing that, that ruling meant basically that every restriction on private care was supposed to be dismantled, and that Quebec should adopt a totally duplicative system where the private and the public system would coexist on all and any levels. On the other side of the spectrum, the unions and left-leaning groups were arguing that Quebec should use the notwithstanding clause to just ignore the ruling. And in between, all kind of opinions, and everyone pushing the drape towards his or her own interest. After lots of head scratching, then we got a bill. It was called Bill 33, and it's an extremely odd piece of legislation. It's a kind of an omnibus bill. It covers lots of ground, but regarding Shally, it did 3 things. So it legalized the sale of private insurance to cover publicly insured services, but only for 3 of those services: hip surgery, knee surgery, and cataract surgery. Why those? No one knows. Dr. Shally was a GP, mostly arguing for his right to provide home care privately, so it does not connect. George Ziliotis did indeed had hip surgery, but why those 3? Well, one of the reasons is probably that there could have been a market, but why was the government narrowing down the ruling to that level is a mystery. The Supreme Court did not say it's illegal only for those surgery. The Supreme Court said it's illegal to prohibit the sale of private insurance, and the government said, well, actually, you know what? Only 3 is going to go. Second thing that the government said is that they implemented, well, they regulated the maximum wait time for those 3 surgeries again, and they implemented a monitoring system so government would know how long people wait, which wasn't something that we had before. And the third thing, and that's another oddball, is for a patient that is on a waiting list, if the patient goes above the mandatory 6 months waiting, then the patient has the right to get another doctor in the same hospital. If that doesn't work, another doctor from another hospital of the same region. If that doesn't work, another doctor from another hospital in a different region. And if none of this works, then that patient could go in a fully private clinic to get the surgery done by an unenrolled physician, and the government would pay that bill. Okay, so that's Bill 33 law. And when it came out, no one was able to forecast where it would lead. I, as any other person I've heard on the subject, we all understood this as very significant infringement on the public system that would lead to a total crumbling of the system. And this is when the rest of Canada stopped paying attention. This is when, you had the ruling, everyone was excited, everyone had an opinion in Canada, and then in between, until Bill 33, people paid attention, wrote paper, and then disappeared. But this is when it really got interesting. So on the ground, it's legal to sell and buy private insurance to cover hip and knee surgeries and cataract, but that insurance market does not exist. As of today, it is impossible for anyone in Quebec to buy those insurance products because no insurance company sells them. So it's legal, but it does not exist. Time monitoring, that's another super interesting one. So the system was implemented and broadened, and last week I had a look at this, the stats. And as of last week, 22% of the patients in Quebec waiting for a knee were above target, 21% for a hip, and 9% for cataract surgery. So we are actively monitoring wait times and then doing absolutely nothing with the data. As 1 patient out of 5 is above target and nothing happens. And nothing happens to the point that the third option, that you might go to the private sector if your wait is too long, was never used by anyone in Quebec. So if you got this, you got a Supreme Court that says illegal to prohibit the sale of private insurance. Then the Quebec government says, well, we'll actually only look at 3 surgeries. And then the reality is that none of this connects. The law that we implemented has no connection whatsoever with the practice. So I think this is one of the lessons, and I'll get back to this, but for the Cambie surgery trial, is that from the ruling to the practice, there is still a long way to go. Does this mean that nothing happened in Quebec? Not at all. Actually, lots of things happened in Quebec. And since Shally, I think Shally was a turning point in Quebec's public system history. So 3 things I think are worth discussing. Private interest, private investors, doctors who like doing business got the message that private was the future, and they move aggressively in that direction. For example, in Montreal, there was a plan to build a new University of Montreal University Hospital in a new place. Actually, we never did it, but when the decision was announced that the hospital was going to be built in that place, private investors started to buy land around the hospital so as to built private clinics. Some of those private clinics were built even though the hospital wasn't. And it's just one ingredient where you could see private money flowing to create infrastructure and to create markets for private services. Most of those services, not those being covered by Bill 33. So across the board, orthopedic surgery, ophthalmology, dermatology, usual suspects of the things that you can sell easily in healthcare markets. Second thing, many doctors decided to unenroll from the public system and to go fully private and bill their patients. And most of those doctors are GPs, which is also interesting. Bill 33 is about specialized services who decided to unenroll GPs. I'll get back to this. And an amazing innovation capacity in gray zone billing, illegal billing, whatever billing, but people had to pay fees. And this is also something that really shaped the collective mentality in Quebec. Patients came to accept the fact that if we were going to have medical services outside the hospital, even though you present your care card, you might be billed for something. Or first visit fee, or file opening fee, eye drop fee, whatever fee, but there's going to be a fee. And those fees range from like a $20 for first visit fee to $300 for every visit to the ophthalmologist. And this became integrated as the norm. I'll get back to every one of those 3 points. So I decided last week to look at, so if you Google in French, private clinic in Quebec, what do you get? So the dark green map is most of Quebec. You can see that all those private clinics are centered around Montreal, and the other map is a zoom on what Montreal looks like, and you get quite a few of those private clinics. Those are unenrolled, totally private. You go and you pay for what you consume kind of care, and they're not like mom and pop basement kind of businesses. The picture is a thing called Clinique 1030, which boasts to be the largest private surgery structure in Canada. And it's a full building. They have operating rooms, they have many kinds of specialties, they can do all kinds of surgeries. To open such a thing, you need large amounts of money. Investors are backing that up. And those clinic cater to all kind of markets. Clinique 1030 is mostly dealing with worker board compensation surgery, orthopedic surgery, but some clinic cater to mostly an international clients, some cater to wealthy individuals, but there are many options where you can see that there is a market capacity to provide care. And again, Shally ruling said one thing, the law said something else, and then all this is unrelated to either the trial judgment or the law itself. Second thing that was fascinating is physician decision to unenroll. So Quebec has pretty lax laws regarding physician capacity to unenroll. It only basically take a month and something for a physician to go full cycle from being enrolled to unenrolled to back enrolled. So many physicians go in and out of this system multiple times per year. The basic trick is you go to the hospital as a specialist physician, you diagnose your patient, and you put them on your private clinic waitlist where you're both the owner and a physician, and then you send them for like a 2 months wait, telling them that if it were in the hospital, they would wait 2 years, and then you unenroll, you go, you treat all those patients. When they're done, you get back to the hospital and you diagnose again. So, and given Quebec law, that's perfectly legal and totally functional. So the number of physicians goes up and down, but red dots on this graph, and it's about probably it's 99 to present. Red dots are specialist physicians that are unenrolled, and blue dots are GPs who are unenrolled. And I draw two regression lines for the dots before Shally and the dots after Shally. Orange line is Shally and green line is Bill 33. What you can see is that for specialist physician, Shally ruling did not change the trend. Specialist physicians were unenrolling and a slowing upward trend, but the Shally ruling was a deep turning point in terms of GP deciding to unenroll. And yeah, it could be something else that just happened to happen at the same time, but definitely something happened there. And my understanding is that what happened was that message. There is a place for a private market in Quebec. And it's big business. Around Montreal South Shore, the proportion of GPs that are unenrolled is big enough so that the wait list in the public sector it's almost impossible to get a GP, so people have little choice but to go in the private sector. So again, the ruling did not talk about GPs, but the practice did. And if you look at specialties, so the number of specialist physicians that are unenrolled is pretty low, but if you look at by specialty, it varies a lot. So here are all the specialties where you have at least one unenrolled physician in Quebec, and most of them are under the 4%. 4% of GPs in Quebec are unenrolled. Most of the specialties are under the 4%, but some are above. And take dermatologists, who is the highest unenrolled rates in Quebec, with 14% of Quebec's dermatologists are not enrolled, but all of those unenrolled are Montreal. So in Montreal, if you have a new little problem, like you go to your GP and you have a little worry and your GP say, you should show this to a dermatologist, good luck. The only option is going to pay. At finding a publicly enrolled dermatologist that accepts new patients for emerging small problems in Montreal is impossible. So the only option is going to go to a fully unenrolled private clinic sector, which means that in practice, some tiny pockets of, medically necessary services in Quebec have been moved out of the Medicare system. And again, mostly by the drive of just everyone moving in the same direction because of the thought that this is how things are done. And last piece of data I would like to show is how the collective mind changed regarding paying for care. So I looked in Quebec 4 main newspapers. The occurrence of a given term, which is frais accessoires. Frais accessoires is a very specific term that is used in Quebec to describe co-payments when you go to the public sector and the doctor asks you to pay for something else. I went probably 20 years back. You can see that when the Shally ruling appears, suddenly in the media, people started to talk about frais accessoires. It became a thing. And one could have thought, and this was what I thought would happen, is that, Bill 32 was on the table, no one knew where it was going, so frais accessoires was all over the board because no one knew if we were going to move in that direction. But that's not what happened. It never went away after Shally. That notion of frais accessoires stayed front and center of the agenda still until now. There was another big peak when Dr. Philpott, when she was health minister, kind of was more, intervened more directly to ask Quebec to stop allowing double billing practices. And my dear friend, Dr. Barrett, health minister at Quebec at this time, had to obey this, and then Quebec started legislating to forbid frais accessoires. What's interesting is that it didn't work exactly that way, even though the federal government moved to prohibit double billing. Double billing is still very healthy, thank you, in Quebec. So as soon as the Shally ruling came, something changed in the collective mind again. Something that just makes things possible. So a few lessons from Shally to Cambie. The first one, and this, I think, as pundit commenting on Shally and Cambie, we were mostly all wrong about, is that the ruling is going to be the end of the story. So we know Cambie is going to go to the Supreme Court one day, and there's going to be a ruling. We don't know what it's going to be, but whatever it is not the end of the story. A new story will start at that point. And what we do with the narrative, what we do with the implications is going to be crucial. Things are still open after the ruling. The second thing is, when a private market opens, it's like toothpaste coming out of the tube. You won't get it back in easily. It's not going to disappear. And even when government try to legislate and to enforce the laws to make sure that, for example, double billing is prohibited, it's not that easy. I will give you just one example of the creativity. So there is a well-known clinic south of Montreal, urologist, all the urologists of a given hospital open their own clinics where they basically self-refer their own patient for private, well, it's double billing practice. So patients come in, give their care card, the physician bills the government, but also asks for a $300 fee for whatever it is. And so this is frais accessoires. This in 2006 was then clearly prohibited. What happened? Do you think they stopped billing $300? No, they didn't. They're more clever than this. What they did, that they noticed that medical imaging done outside of hospital is not covered in Quebec and never was for a long time, so it's legal for clinics to bill patients for medical imaging. Whatever it is, those urologists bought an echography machine, and every time a patient walks in, they put it on and off. So that's medical imaging, so they can bill whatever they want for this. And guess what? They bill $300. So from a patient perspective, once that clinic decide to move privately and say, well, we're going to bill patient for the care, they found and still find ways to do so. Despite the government's best effort, and I think the Quebec government did try to close the door, just that door is not closing properly. As soon as the infrastructure, doctors are there and they have a business model, clinics are there, investors have put money in there, it's not going to disappear. And one of the things that Quebec showed is once you create the infrastructures, the doctor moved outside of the hospital a big part of their practice. And doing so, they also invested heavily. They bought machines, they hired staff, they rented offices. All this costs money. And the payment system was not designed to handle that kind of pressure. Physicians expect that when they work in a hospital or where they work in the clinic, they get the same income. They're absolutely not ready to cut their income by a significant cut so as to pay for the infrastructure. So what do? They bill the patient for this. And so what the Shally ruling did in Quebec was also to just create that pressure at the seam in the whole funding system for medical care, and that the seams cracked. And at present, we still haven't found in Quebec a way to mend those seams. If the government decides to pay for all this, then appropriateness of care goes down the drain, and then whatever services are going to be paid for are those that innovative and creative and money-friendly physicians decide to offer, which is not rational from a system perspective. But if the government does not pay for this, then it's going to be the patient, and it's going to be silent privatization. So it's extremely important, I think, in the context of a ruling that is in the media and is everywhere, that the government be serious in making sure that the damn toothpaste does not go out of the tube. And if you look at BC currently, well, I'm not sure BC government has been that serious in keeping the toothpaste in the tube. There are all kind of innovation on the ground in BC where you see physician billing for all kind of stuff. And generally, people just accepting it. Patients just say, well, I'd rather pay than not having services. The government say, what, something? I don't see the intervention. And one of the key lessons from Quebec is don't do this. Because even if we win, even if the Attorney General of BC and Canada win at the Supreme Court level and maintain the current prohibition in the system, it doesn't mean that that ruling is not going to lead the way toward more private. Thanks a lot.